So it's my pleasure to introduce Surani Abeyesekera. She's a social and behavior change specialist in the immunization demand team in UNICEF. Actually, we met during COVID-19 while she was C4D chief in Kenya. And that was a lot of good work was done there, and also in collaboration with the African Infodemic Response Alliance. So I'm all infodemic management related things nerd. So I'm really happy that Surani will introduce this lecture, this topic to you. So welcome, Surani. Over to you.
Thank you, Tina. And I just like to acknowledge that, this is a joint lecture between Tina and myself. So we'll do a little bit of a duet as we go along in terms of the content of this training. And, it's been a pleasure working on this. And I mean, we are so thrilled. I think Deepa also mentioned that, we are involved in this training and seeing the participation now. We are into the second sessions. This is our last second session. So some of us started our day at 3 a.m. in the morning. And we're still awake, so hopefully I won't fall asleep during the session. So let's move on to the next slide, please. Thank you. So what we will cover during this session is we'll take a look at some of the key definitions on some of the words that we keep using and throwing around when it comes to this area of work. We will look at the impact of infodemics, and we will also discuss briefly what is infodemic management. We'll take a look at what challenges are posed by the evolving information environment, how infodemic management can adapt to the evolving information environment, and then we will also leave you with some key references and resources as well. The next slide, please. So what you will be hopefully left with is an understanding of different aspects of the information environment that pose a challenge to health authorities during an infodemic. You will also be able to describe the basic concepts and principles of infodemic management as they relate to the rapidly changing information environment. So we're hoping that through this session, this is what we can hopefully leave behind with you. Next slide, please. Okay, could you click through a few more times? Thanks. So in terms of some of these definitions, what is information ecosystem? So the information ecosystem basically is the exchange of information and communication in a digitized society. Where we're living today is a completely digitized society. We depend so much in this digital environment, on this digital environment. So this information ecosystem is something that is built around this digitized society. What do we say? We hear the term unsettled science. What does that really mean? It's in the absence of a definitive answer or a scientific update to respond to questions that people are seeking answers to. We see that, numerous questions and information gaps keep coming up, but we may not have the answers to everything. We don't have the science to back it, and neither do we have a definitive answer to provide. So these are areas that are slightly gray. So this is the unsettled science area. When we say message penetration, what do we mean by that? This is basically the ability of a person to receive and understand information as it is intended to. So when we or anyone passes on a message, we have a basic understanding or basic idea that this is what we want our listener to get out of our message. So that ability of understanding, not only receiving, but understanding what we are trying to say, the way we want to say it, is message penetration. When we look at information voids, basically this is people seeking information but find a lack of credible sources that are out there that are talking about this information gap that they have identified for themselves. Rumor, basically, this is information that is inaccurate, or it could be accurate, which is circulated within a network. So within a network of your friends, your peers, your professional groups, your community, wherever it may be. Misinformation basically is information that is not correct. And then disinformation is misinformation specifically designed to achieve an agenda. We've seen this happen quite a lot. We saw it happening when the pandemic hit, and we were dealing with disinformation, willful, spiteful in a way, the information that is twisted in a way that it becomes very untrue, and it's done purposely. We saw it when we were dealing with HPV, for example. We saw it when we were dealing with polio. So these are things that are calculated in a way, and it's out there. Information overload, that's exactly what we are all suffering. And I hope you're not suffering from information overload through this comprehensive training. But this is where a person is being overwhelmed with information, which can cause confusion or difficulty to act or on the guidance that is provided, because he's hearing so many things from so many different people in so many varied ways. So how do I take that information and figure out, what do I do? How do I act on it? Do I act on it at all? So that's as a result of the information overload. In terms of infodemic, what it means is an overabundance of information in digital and physical space, including misinformation, disinformation, accompanying an acute health event, such as an outbreak. So basically what it means is that, there's this huge amount of information. And what is very key to understand here is an infodemic is not something that you can that you get just because of social media. It could be other platforms like community media or offline media channels. So it's all this information that this human being is getting, and it could be correct information, it could be misinformation, it could be disinformation. But usually what happens is it accompanies the health event or an outbreak or emergency of that nature, and then it spins out of control because of the fact that there is very fertile ground for an infodemic to take place. Next slide, please. So what's the problem? Let's look at what the problem is. Next slide. So we've seen how infodemics can cause real harm. We saw it in Iran, for example, when people thought that drinking alcohol could cure COVID, and we saw more than 700 people dying as a result of that. We saw it happening in many other countries in terms of, saying this herbal concoction is going to help us to overcome the disease or keep us protected. There were some countries that were doing these steam baths or high, I don't know what it was called, like a steam room type of thing that they said will prevent people from getting COVID. So all these things are happening out there, and this is how it can harm take people who are actually responding to the emergency or the situation away from their job. So there's more people getting sick, more people have to be taken care of, while they could have been using that time to vaccinate people, for example, or to do something else that is required. So there is a huge impact of infodemics on so many areas of work that we are involved in. Next slide, please. So the impact of infodemics are many. So there's a direct impact on health, like what we just saw in the previous slide when we were speaking about the Iran situation. There's a huge impact on morbidity and mortality as a result of the infodemic related to that particular issue. There's a misunderstanding of health information and behaviors that needed to be adapted. There was so much going on about mask wearing, for example, in so many communities, so many cultures. And, so it's like, you're confusing the person to figure out, what should I do? Should I wear a mask? Should I not wear a mask? Should I go out in public? Should I not go out in public? So it's this whole confusion that is caused because of the infodemic itself. The whole area of mistrust in government, mistrust in science, on experts, on public health authorities. Mistrust is something that is another huge burden that we carry when it comes to infodemics, in terms of, do we trust what the government is telling us to do? If, for example, they've had a history of an issue that people lost trust, that's going to have an impact on what we're doing right now. Maybe the government is telling the truth. Maybe the government is saying what they should be doing. But because of previous issues, this mistrust has grown and people haven't still recovered from it. Mistrust in science, is it too soon? Has the vaccine been churned out far too soon without doing the required research that is required to get the vaccine out there? How did they do it so fast? This whole thing about mistrust in the process, it's there's a conspiracy. It's created by a human being sitting in a lab somewhere wearing a white coat. The whole area of mistrust in terms of the public health authorities. So these are areas that we are hugely impacted by infodemic. In terms of the impact on the response and the interventions, we saw that even when vaccines were out there for people to actually access, people didn't want to go because they didn't trust the vaccines. So then there's a huge area of effort that needs to be put to bring those people to be vaccinated. The whole area around stigma, we saw that heavily during Ebola, for example, where there was so much going on in terms of, the stigma related to someone getting sick with. I mean, we saw it even in COVID. Initially, nobody wanted to say I had COVID because the stigma attached to it. You don't want to go and see that person. You don't want to go and meet the person even after the infectious period is over. We also need to also allude to this area of social cohesion. It undermines that whole social cohesion of being able to, depend on each other and work together and all that. So the impact of infodemics is many. Let's move on to the next slide, please. Okay, so this is there's a lot on this slide, but take a look at it in terms of trying to digest how things move, how information flows. So, for example, you have this new confusing public health guidance that has been issued. Maybe it's a simple thing as wearing a mask, but maybe it was not said in the proper way, and people really got confused about it and didn't really know what to do with that piece of information that they had got. Media takes it and makes it very prolific, and they talk about it in such a convoluted way that nobody knows exactly what you need to be doing. There's a lot of memes and all that is generated out of this media attention on this particular guidance. You may take it, get the information, but decide that you don't want to do anything about it because you may have some other information that backs you in terms of thinking that this may not be something that you really need to explode on. But there's someone else maybe who takes it, who keeps passing it on, it generates, it starts getting into a big, the snowball effect type of thing. And how that then impacts what happens at societal level. You're taking away time, you don't wear a mask, you go to a big event, you create a big group of people who are sick. The people who are working on the health program, for example, the vaccination program has to be taken away from vaccination because now they have to deal with the sick. So you are having so many spillover impacts on different areas of work. So what we're looking at here is, the individual impact or the community impact and how this can snowball into the whole societal impact later on. Next slide, please. So this is just an overlay on the previous slide in terms of some of the things that we need to, some of the challenges in terms of information ecosystem. some of the things that we are now, really putting a lot of emphasis on is this area of trusted messengers. It's not about that man in the white coat with the stethoscope around his neck in terms of, trying to pass on because it's a health message, but who does each audience empathize with, trust, and then will listen to. Maybe for young people, it is the street DJ, or maybe it is someone else, that will probably resonate very well with them, and they look up to this person to give them the correct information in the way that they understand it. The infodemic entwines with other societal issues which affect behavior. So what's going on in the society that will then prevent a person from behaving the way that they are supposed to be behaving? How does the health authority communicate, and what is the process that they communicate? Do they hide information initially, and then just because it has leaked, now they come out with and fumble with that information? You even lose more trust while doing that. The whole area of precursors information. What are the precursors that we need to keep an eye on, and how do you look at that? So these are some of the challenges that we need to keep an eye on and figure out how we move forward on that. Next slide, please. So let's look at what this infodemic is. So an infodemic is basically an excessive amount of information about a problem that is typically unreliable. It spreads very quickly and makes a solution more difficult to achieve. And we've seen this, and we saw this right through the last 2 years of work. And I think a lot of us have been working in this area and have felt the impact on this in terms of how quickly unreliable information spreads, and then how it has such a huge effect on what your response, how you need to solve the issue. It could have been much easier if this misinformation didn't spread as fast. And then if you look at infodemic management, what does that mean? It applies basically evidence-based interventions by analyzing concerns, questions, narratives, information voids or gaps, and misinformation to effectively address health information inequalities at towards the target populations that we are working with, and that stops people adopting these health-seeking behaviors. What is key here is that we need to make sure that when we think of infodemic, it's not about social media analysis. It's about the analysis of different platforms. It's about analyzing what is being said in the communities. What are people saying? What are they talking about? What is the trending topic at that level? What's being said in offline media? And then looking at what social media is also saying and trending on and all that. You bring all these and triangulate this information and then come up with your analysis. Then you figure out where there are the information gaps. What are the misinformation that you have to keep an eye on? Are there things that you have to address immediately? Or are there things that you keep an eye on and not let it snowball? And if you think it's getting into that snowballing effect, then you address it at that time. And there are some things that, let's not even go there. Let's not even bother about addressing that. And we move on. So it's very important to understand, that this term infodemic management is not specifically related to social media analysis. Please, let's move to the next slide. Okay, so this is a slide from our WHO partners and colleagues, and it's showing in a way what are the big buckets of work that we're looking at and how this area of work, the impetus that was given to this area of work that we are now concentrating on. Yes, we dealt with rumor management and misinformation in the past as well. 20 years ago, we were talking about it when we were doing polio campaigns or when we were doing measles campaigns. But I think with these big public health emergencies that we have been dealing with in the last several years, there has been more focus on this area. The World Health Assembly bringing, strengthening this area of preparedness, asking us to strengthen work in preparedness and response to health emergencies, gave it a lot of life. The fact that, we had this cross-regional statement that was part, signatory of, many signatories who endorsed this. It's another thing. So these global highlights have actually brought more emphasis in this area of work. But one of the things that have been realized is that it needs to use a whole of society type of approach. You can't do it alone. It's not something that someone can solve overnight and by themselves. There is a huge focus on the science aspect, and linking the science to the practice. We have all these different types of research that is going on, whether it's rapid assessments or the community behavior insights that we are trying to identify, message identifications and messenger identifications, so all this research is linking it to the practice of the work that we are doing. And that's something that is really, really growing, and a lot of emphasis is being put on. The third area is the support and guidance and tools that are provided to the countries so that they are able to understand community concerns, questions, and then build trust in the intervention through the interventions that they're working on. This is one of the, this is just a snapshot of something that is being done. There are other interventions that are being done. So, for example, what we are working on is this area of triangulating insights from social media, from mass media, or offline media and community insights, and bringing it together, human eyeballs actually looking at it and then saying, yeah, act on this, don't act on this, maybe you need to look at that. So things of that nature. Then, bringing that whole professionalism part into it, the past infodemic trainings that have happened, this training that is going on now, we really want to build a cadre of people who have the capacity to deal with this issue. It's a new area of work, a new area of new discipline that we want to bring, a lot more professionalism into it so that we have more people fighting the battle. Next slide, please. Okay, stemming from the previous slide, in terms of managing epidemics, and the whole infodemiology area of work, we need to make sure that initially we measure and monitor the impact of infodemics during a health emergency. So you prepare, you monitor, and then while you're monitoring, you see that you start detecting that there is a spread or in terms of or infodemic starting to happen. You detect what's going on. And then you figure out how to intervene on that. You respond and deploy interventions that protect and mitigate the infodemic and its effects on whatever health emergency that you are working on. You then look at strengthening and you evaluate infodemic interventions that you have already put into place, and you strengthen the resilience of individuals and communities to deal with this. This can be done in many ways. For example, one thing that we are doing at UNICEF is working with some researchers to look at gamification, looking at introducing a game to respective target audiences, and then it's like actually vaccination. So you inject them, it's an inoculation game, you inject them with a little bit of misinformation, but then you equip them with the critical skills to identify whether it is misinformation or real information. So you are building that capacity, that internal capacity to be able to look at something that you're hearing or seeing, and then figuring out whether this is something that, whether it is misinformation or whether it's correct information. So it's like a vaccination. It works the same way as a vaccination. This is some of the things that, we together are in this area of work trying to put into the field. Next slide, please. We see how technology has changed the way information is produced, distributed, and consumed. In the past, we saw how people had to you produce something, it was very static, you put up a poster on the wall, and you put up, if it's a health message, you put it up in the health facility, you expect people to read it and understand and behave the way you want it. Today, it's completely different. And Infodemic thrives on online and offline, requiring a whole of society and whole information ecosystem approach. Managing the infodemic has become a more challenging and more rapid spread of misinformation through digital media, because it's very quick. You press the button, you forward it. You press the button, you forward it. And it just keeps spreading like wildfire. Infodemic management will help us better manage this pandemic and more quickly tackle new and resurgent health threats. So by building a capacity to deal with this type of thing, we are hoping that we will be better equipped to deal with emergencies of this nature in the future. The next slide, please. Tina, can I ask you to come in on these slides, please?
Sure. Thank you, Surani. So if we're thinking about how important it is to consider how has the society changed because of the digitization of many different services, many different aspects of our lives. This is not only about the fact that we communicate differently because of the internet and the different tools that we have to communicate with each other and to find information, but also because the way that technology has been designed, we now have smart homes, and the internet platforms themselves run on emotive levers and mechanisms by design to catch attention. Even our governments function differently now because of the digitization, and that actually means that not just that the content is not only differently generated, but it's also very differently diffused across different networks and also consumed. Now that means that we need to really pay attention to how do we think about how is this affecting our ability as public health professionals to respond to overwhelming amounts of information, outdated information that is floating around in communities, and also mis and disinformation, or just lack of it, actually. And this is where the digital ecosystem comes in. Next slide, please. It's really important to consider that while our societies are changing, and there's even some statistics by International Telecommunications Union that project that even in pockets across the world, for example, the African continent, which currently has the lowest internet penetration, within the next 5 years, it will almost double the coverage of internet access by the population. Even when this is happening, we still need to be aware that an additional aspect of inequalities that we've been discussing today is also the digital divide. When we try to think about how does technology and information ecosystem affect people's access to information, how they can search for it, how they can answer questions that they have. We also need to understand that it's not just about their access to internet, for example, but also about their ability to search and also use the information. So when we think about interventions, or when we think about how best to promote information through the digital environment or offline, these are the types of things that we need to consider as well. Next slide. So Surani, over to you. You have great experience from the field. If you comment on the three truths from the field that we put forward.
Thanks, Tina. Next slide, please. So the first truth that Tina was talking about is basically the multidimensional and interconnected information ecosystem. So let's look at what this means in the next slide. So some of us who are old enough to know what the ecosystem was in the past, where it was very basic. where we didn't have too much in terms of search engines, and messenger boards, where the bulletin boards were what were being used and all that. So how information was being shared at that time. And now, in terms of what the way it has evolved in terms of social media that drives media's circle across borders. You don't, you can't keep a rumor in a country. It crosses borders, it crosses oceans, and it moves out fast. The online hype influences media reporting on TV and radio across the globe. So it could be a story that was born in an online platform, but then that drives what our radio and TV news, for example, focus on, because this is trending in terms of such a huge audience group. Health information does not compete with low quality information. So how does that have an impact on what we are doing? So some of the trends that we see is closed messaging apps. We can't monitor that. I know there was a discussion even in this morning sessions, can we plant people in closed messaging apps? And, it's about this whole area of ethics. If you are present in a group, you need to say what your purpose is. The imposter content, we believe in Dogos. So how that impacts on, looking very credible, and how that has an impact on the information that is shared. Misinformation and hate speech interest, so it's about, it's a virus from this part of the world or that part of the world, it's a virus for this type of people or not, so this type of conversations really has driven certain agenda and we saw it during the last couple of years. Videos, memes are getting more influential as they look more professional. So you look at something and you think, maybe this has to be correct, this has to be right, because, look at this video. I mean, it looks as if it was produced by this really respected organization. The whole area of conspiracy theories, this man sitting in a lab in a white coat with a test tube in his hand actually developed the COVID virus, and now he has spread it right around the world. Next slide, please. Let's look at the next truth. So here we're looking at the information ecosystem and how personalized it is. Let's move to the next slide to talk a little bit more about this. So for example, I'll give you an example. You go on, say, kayak.com today, and you just check out the price for a ticket to Aruba. And tomorrow you open your email and you'll have emails coming from various tour operators in Aruba offering you boat rides or offering you excursions or whatever it is. So you don't realize the online digital footprint that you have left, the trail that you have left behind just through your search. And this trail teaches digital platforms what your preferences are, what are you looking at. So it applies to even information. I'm seeking information about, sterility in women as a result of COVID vaccines. And then you start getting more and more information on that particular topic, conversations that are trending on that particular topic. Then it's more likely that you're going to now start believing it, because so many people, so many articles are now talking about this. So, but it's because of your original digital footprint that you have created that you are now seeing that. Based on your personal data and online behavior, the algorithms, the apps, the websites, they select and target advertising to you based on your preferences. And this will fuel and fill your bias, basically. What you see online is unique and tailored to you. And we sometimes don't even know that this is happening to us, and how much of a footprint we're leaving when we even just do a search. Let's go to the next slide, please. And the third truth is the experience, emotions, and addictions are everywhere. Let's move to the next slide to talk a little bit more about this. So what do we do early morning? We wake up, the first thing we do is we reach for our phone. We have uploaded 5 pictures of our trip to Aruba, and we want to see what people have saying now about how many likes have I got, how many people have actually looked at it, how many people have put comments on it. This emotional attachment to what we are seeing and what we are doing on the net basically is the interaction between the human and the technology. The interaction will become a daily habit for a lot of us, and it's based on this whole neurotechnology area of work. This kick that we get just because we are creating a wave now of, how many people are actually seeing what I'm doing and reporting on it and commenting and putting smileys and putting hearts and hugs and all that. It really keeps us hooked to these platforms and this information that we send out and get as a result of this area of work. Let's move to the next slide, please. So we need to adapt our way of interacting with people, and this is very key. We can't sit on our laurels and think that, just because we are sending out a life-saving message that, people are going to sit down and listen to us. I always think, how is it that we are promoting life-saving messaging and we have such a small share of mind in people, but there are companies that are selling colored bottled water with sugar in it, and they have so much headspace in a person's mind. And you wonder how that is happening. And it is because those organizations have learned that they need to talk to the people and, get those message worms engraved in your mind. And they say it in such a fancy way and such an exciting way. Our boring doctor with a stethoscope is not going to win over that message that Coca-Cola is doing, jumping over hoops and jumping through buildings and, riding the waves. So how do we do that in terms of individuals, looking at how individuals have multiple identities? What I am at home may not be the person I am at when I go to the office or when I'm riding the train or whatever it is. So how do we target these different identities? How do we build on that? We need to challenge our assumptions about where the people are, how they interact, what their information needs are, what communities are, or the stakeholders of public health. And this is not about public campaigns. It's about, really understanding our audience and figuring out what their drivers are. How do you look at it in that aspect? We need to connect with our communities that build health. And also, that people that we have not previously engaged with. We saw during COVID, how we started engaging with completely different type of people that we've never engaged with. I remember I was in Bangladesh at the time of, what was it? H1N1, this bird flu, swine flu period of time. We worked with people who were this local herbal medicine vendors. We didn't associate our name, but they had a huge captive audience. And we just told them, just talk about not spitting on the streets, and to wash your hands with soap and water. And, they felt so proud to be talking about a health message where they were normally, just selling this colored water in little bottles for cures, for everything. And it really helped, so it was a very untraditional communicator. The way in Nigeria, for example, you work with this lady who goes from household to household, selling plastic buckets and bowls. And she has a wealth of information and knowledge because she visits every household. She knows about who's getting married to whom or who's run away with someone else. But you give her a message to take from house to house, she can become your message carrier. So it's looking at where can you reach these people. It doesn't need to be your traditional messengers, but how do you touch these people in different aspects? Let's move on. We need to adapt to new individual reality. Basically, we have to challenge again our assumptions on what people want, how people experience public health prevention activities and interactions. In order to adapt public health preparedness and response activities accordingly, we need to develop human-centered interventions. And you saw that this morning when you looked at Fikali's journey and looking at, how the experience that she gains right through that journey impacts on how she behaves, and then how she will then talk about the behaviors that she has adapted or not adapted. It goes beyond the sentiment analysis done by AI technology. So that's why I was saying, the importance of human eyeballs actually looking at the content and then seeing and analyzing and looking at, how do you then address this issue? It's not about a computer telling you what to do. Addressing the pain points of the population in the entire public health system. And this is very important because you can't ignore this. And you do something like it's CD, for example, you are able to really look at these areas of work. I think I've come to the end of the presentation. Have I not?
Yes.
Oh,
this is the last one. This is the last one.
You want to do that?
No, well, shall I?
Yes,
you've actually stirred so much discussion both on Slido and in chat. I think this is really an important topic. To reassure everyone, Surani and I will be back next session to discuss specifically about social listening. And then there's several other topics on infodemic management intervention toolkit and how to address health misinformation. There's much good work done, so I hope that we will address some of your questions also with more practical things. What Surani has presented is really the topic from a very bird's eye perspective. Why should we care? And so let me finish now with this last slide, which I think is also quite important. Someone was actually mentioning in the chat that memes can be very powerful way of influencing people, and videos. Surani mentioned it as well. As memes and video projection, anyone can create an extremely professional video or a meme. Then they can also have a much more influence when they set it free on the internet. So we have to do the same. We need to really also develop much more sensitive and tailored approaches to how to use these new mediums. Memes are actually, some people say they're language of the internet, and so are hashtags, because they allow the information to spread and to target, to reach certain populations online faster and more effectively. So we really need to then challenge our assumptions about, well, when we do communicate digitally, the same amount of efforts that we're putting into understanding the offline audiences, well, how do we effectively communicate in tandem online? Maybe Trusted Messenger is a healthcare worker who basically connected with their colleagues online and is answering people's questions and also challenging vaccine misinformation, for example, online. We've seen this during COVID-19, and this was not an organized activity online by any Ministry of Health or any institution. This was people organically coming together, creating a community online, and actually effectively addressing things. So this is where infodemic management complements and thinks really through, well, how does the information ecosystem work? And what are the types of additional strategies to what we have what we have done until now to do this? Now, to do this effectively, I cannot underscore more what Surani has also repeated several times. We have to be thinking, well, how do we do this in a human-centered way? We need to understand what people need and how they react to information if we want to be effective responding to their needs, to the audience needs, and to deliver information in effective ways. And this is, of course, where behavioral and human-centered design approaches are really important. I would stop here. Thanks, Surani, because I always get excited and start ranting on this. This is such an important topic. We will try to answer questions in Slido, and also Surani will be back next week. There's really great work done in monitoring of the infodemic, and analysis. This is one of the basic skills and tools that one can use to really start thinking about anything related to infodemic management interventions. And actually not just that, also informing public health programs and immunization programs. So thank you, Surani.